Well, in our first story, Ghana recorded 19,000 tuberculosis cases in 2023, an increase of 15% from the 16,500 cases recorded in the previous year. Yet not much is being done to create awareness about the disease and its dangers. Sarah Penko reports 25-year-old Abdulai Adamu would have died of tuberculosis 2 months ago, but for the benevolence of his friends.
25-year-old Abdulai Adamu migrated to Accra 4 years ago from Sandema in search of greener pastures. As a scrap dealer who hustles with friends on the streets of Achimota for survival, he had no idea about tuberculosis.
3 weeks,
I was sick for 3 weeks. I was coughing, vomiting with chest pains. I didn't know anything about TB then. I am told I'll be on treatment for 9 months.
He has been on treatment for the past 2 months and now knows better.
The TB disease is not an easy sickness if you don't have a helper. You need to protect yourself when you go out. I thought I was going to die.
TB is a contagious bacterial infection that mostly affects the lungs. In Ghana, tuberculosis is responsible for over 5% of deaths recorded annually. Currently, the country records between 15,000 and 19,000 cases of tuberculosis, compared to the 44,000 cases expected to be detected each year. This means over 20,000 cases are missed each year. Yet, the inadequate number of Gene-Xpert machines to facilitate testing for TB in the country is a major bottleneck, hindering progress in the fight against the disease. Currently, there are only 171 Gene-Xpert machines serving the 261 districts in the country. More worrying is the fact that the National TB Control Program is not certain if the country has enough cartridges needed to test for cases starting next year.
For 2023, all year round, we were not short of cartridges. There have been some rollover of the cartridges in 2024. We are not sure about 2025 and 2026 unless government comes.
Abdul Rahman Ashley is a TB champion in his community, Sabo Zongo, in the Ablikuma Central constituency in Accra. He is well known for helping TB patients get the needed support for treatment.
Facility now, a lot of people are.
When you visit the facilities, most of the infected persons are very poor, and some of them are requested to pay for some labs. The government needs to support them.
Government challenging financial TB crimes in our patients.
At a media sensitization workshop on tracking the United Nations high-level meeting on tuberculosis, experts raised concerns about the government's inadequate commitment to the fight against tuberculosis. Executive Secretary of the Ghana Country Coordinating Mechanism of the Global Fund, Samuel Hackman, wants the government to make better commitments towards TB management to complement funds released by the Global Fund.
We can do more to ensure that bottlenecks in our procurement laws and financial laws that stops the country from doing advanced procurement. If those things can be addressed, then we should be able to buy for the people of Ghana. It isn't Global Fund issue.
Anyone can be infected with TB. Abdulai is just one of the most vulnerable among his cohorts who has found himself infected with the TB disease and unable to cater for himself. And so policymakers make better commitments towards the fight against TB in the country. Many, like Abdulai, would remain vulnerable to the disease. Sarah Penko, TV3 News, Accra.